Our next two areas, or our next area of language processing, morphosyntactic processing, we can break down into morphology, which are the rules that govern how we can combine the shortest elements of lexical meaning together. And this is often reflected in how suffixes or prefixes are added, derivational endings such as going from slow to slowly, etc. In general, I don't think we focus a lot on treating these problems. I'm not sure why. I think possibly because when we look at patients and the kinds of problems that they have, some of the subtleties of morphological processing never really rise to the threshold of truly being bothersome for somebody. At least that's been my experience, and I can't remember off the top of my head seeing any treatment studies, particularly on the verbal expression side, that have addressed a problem like this. Although we'll certainly see people with aphasia, language impairments, have make some errors here. More often than not, this difficulty with processing morphology has been discussed more in the acquired reading literature. So people who have reading problems, alexias or dyslexias, acquired dyslexia, not the developmental kind, from something like a stroke or other disease process. Syntax we do treat, not super often, but there are definitely some well-described treatments out there for syntax processing. Syntax being our ability to order words in the correct way, and of course, sometimes we see people with aphasia who are limited to sentences, producing sentences that are canonical. And what we mean by canonical is the simple base foundational form, right? Subject, verb, object. Of course, we can do all kinds of complex things with syntax. We can embed clauses, we can reverse the orders and do reversible sentences, etc. Maybe later, I'm not sure if we'll have time, we'll talk about some of these sentence processing treatments. One of the things that's interesting about these treatments is that some of them have taken advantage of a concept called complexity training. And what that basically means is that instead of, let's say we had a person with aphasia, and they could only produce they couldn't even produce the basic subject, verb, object kind of sentences. Their sentences were very telegraphic. Boy, store, instead of the boy went to the store. Well, we could conceive of treating, getting him up to speed at that basic canonical level, and then going up hierarchically with more and more sophisticated sentences. Programs such as one called Treatment of Underlying Forms, which is a complexity-based treatment, says, no, what you can do is you can start off treating people with complex syntax, and certainly it'll be slower for them to kind of catch on, but what will happen is when they start to be able to do some of the complex stuff, everything that's less complex will fall into line without having to directly treat it. And so from an efficiency point of view, that might be superior. And, it's an interesting example of how things can generalize. Another thing I think relevant to thinking about syntax is that a common observation, let's say you're working in an acute rehab ward, and every week the rehab team meets to talk about the patients on the ward who are getting rehabilitation. And you have a patient who is on the ward, they have aphasia, and they have a non-fluent aphasia. Primarily their problem is with the expression. They have some auditory comprehension difficulties, but not nearly as pronounced as their speaking problems. Oftentimes, you'll hear nurses or OTs and PTs, when they go to talk about your patient with aphasia, they'll say, Mr. So-and-so is doing great. He's got difficulty speaking, but he understands everything. And then you come around and you describe his verbal expression problems, and then you might say he has mild to moderate auditory comprehension problems. And everybody kind of looks at you and says, well, I don't see it. First of all, if we really look at what happens when we're speaking to people, particularly in a setting like rehab where everything is very planned, right? A simple example is the nurse comes in the morning with a tray with little cups on it and says, Mr. Smith, it's time to take your medication. Even someone with very poor auditory comprehension is going to get the gist of what that means, because there's so much contextual information. They know that they take their medications in the morning. They know that the nurse is the person giving it to them, etc., etc. So we can see sometimes patients who, in a functional way, do pretty well. But when we give them tests where we really go through the hierarchy of different types of sentences, more and more complex sentences, we'll often see these people who are purported to have good auditory comprehension start to break down when we start to move away from that prototypical canonical subject verb object type of scenario.